Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
Hey, Janet. Remember when, I hate to bring it up, when you had that bad reaction to the drug that was prescribed for you and you had to go to the emergency room like a month or two ago? Well, think about this. Wouldn't it be great if there was a test that we could do on our pets that would predict whether or not they were going to have a side effect or an adverse reaction to a certain drug, whether it's prescription or over the counter? And guess what? There is a test.
And I heard that Dr. Mealey is like famous.
Okay. Well, let me back
I only
up.
like when famous people are around.
I know. Dr. Katrina Mealey, who is our special guest today, it was actually named Inventor of the Year for that test. She is an assistant dean at Washington State University College of Veterinary Medicine and editor of one of my favorite books, Pharmacotherapeutics for Veterinary Dispensing. And that's no BS. Every time I read a chapter in here, I learn something. And that's if I can get through the chapter because there's so much information.
You know, I have that book on my bedside table.
You don't. I do and love it. But anyway, I want to welcome Dr. Katrina Mealey. And Dr. Mealey, if you wouldn't mind, can you just give us a little bit of your background and how you got to be where you are today?
First, can I start off by pronouncing my last name correctly?
Oh my God.
Yeah, here's how you remember it, right? So I did my residencies and PhD at Texas A&M University, and my husband is also a veterinarian. And so they would call him Dr. Mealey and me Dr. Mealey. So that's how you clever students at Texas A&M. Well, that's how you remember it. But in terms of my background is actually I went to pharmacy school. So I was a pharmacist before I became a veterinarian.
Me too.
Oh my God.
Wait, Janet, you might as well just get off the broadcast right now, Janet.
I'm not going to understand anything.
Where did you go to pharmacy
University
school?
of New Mexico. That's where I'm from.
Oh, wow. Well, did you practice as a pharmacist?
Only while I wasn't sure I could get into vet school. So I wanted to have some.
Me too. My gosh. So I applied to pharmacy school like you.
Got my pharmacy degree, got into vet school. And so I just worked, during vet school to make money. Yeah, it was great, right? I mean, it is a great background for veterinary medicine.
Yes. I had no idea.
Did you work retail or hospital? I worked retail mostly. You have to do your rotations everywhere, but But I did my rotations in pediatrics because I thought that was most similar to veterinary medicine.
Yes. Yeah. Those little kids are like animals.
They're helpless, right?
Right. And sometimes hopeless.
And I know that you're on the edge of your seat. The drug I had the bad reaction to was Xifaxan. Well, it's not something that I'm even familiar with, to tell you the truth.
Same here.
It only treats the gut.
Yeah. Yeah. But anyway, please now tell us, first of all, what is the name of this test?
Okay.
What is this is a loaded question. The mechanism behind it. How do people get it for their pet? The whole thing. Start wherever you want.
So, before I talk about the test, I guess I want to talk about the fact that this protein that the test assesses, it assesses whether the protein is normal or not. This protein is really important for all mammals. So humans have it, and dogs and cats and horses and cattle, and it's all mammals. And it evolved to protect us from toxins we might find out in the environment. So plant toxins. There are microorganisms out in the environment that secrete toxic things, and it protects us, way back in evolutionary history. It protects us from all those things that were encountered in the environment. And we may not, most of us feed our pets dog food, commercialized dog food or whatever now. So there's maybe less of a threat from environmental things. But it turns out that about 50% of the drugs that we use are derived from those natural products, from plants and microorganisms. And so now this protein, it's called P-glycoprotein, is really important for protecting us mammals from drugs that we give that, are supposed to be beneficial. And there's three places that are really important. One is the blood-brain barrier, which is important because, the brain cells are very, very susceptible to toxicity. And we have a, skull, a very physical protective area, but also we don't want everything that comes in contact or that gets absorbed into the bloodstream. We don't want that getting into the brain. So this protein, P-glycoprotein, pumps those chemicals out of the brain to help prevent the brain. Second place that it's really important is if these chemicals are in the blood, this P-glycoprotein is in the liver and it pumps them into the bile, which goes into the intestines and out the body in the form of poop. And so it helps protect the brain, it helps protect the body. And then there are some cells, some lymphocytes, they're called, in the blood. And some of the drugs that we use in dermatology, like cyclosporin especially, those drugs can accumulate in the lymphocytes and knock out the immune system. So those are the three most important places that this protein functions. And it prevents these drugs from getting access to the brain, from getting access to these sensitive lymphocytes, and it actually pumps them out of the body.
So this protein protects us from when we take a drug that it doesn't go right to the brain, that it lets a little bit in or to the liver or the other place. So it lets a little bit in, but then pumps it out again. So it actually is like a gatekeeper where it prevents then the drug from rushing to our brain. It only lets a little bit in and pumps the rest out because too much could be toxic.
Yeah, gatekeeper. I've never used that word before, but I think I will continue to use that. Makes sense to the common man.
And that's for any mammal, dogs, cats, humans, elephants.
Okay. And, I don't think when your doctor, whether it's a veterinarian or a human doctor, prescribes a drug for you, I think we have this sort of confidence in pharmacology, like, oh, this is going to, it's going to fix me and I'm going to get better. And people don't realize that there's huge lists of side effects that you can have from particular drugs.
Well, and individual sensitivities, which is really what this test measures. So does this measure the P-glycoprotein or what, Dr. Mealey, what exactly does the test measure then?
So all proteins are coded for by genes, right? The genes, the things that we inherit from our parents. And what this test does is test the genetic sequence of the genes, because in dogs, there is a mutation that completely disrupts any synthesis of the protein. In cats, there's a different mutation that does the exact same thing. So we're testing for the presence of this mutation in DNA because it's a lot easier to look at DNA, because all I need is a cheek swab or a blood sample, than to try to actually look at the level of protein in the brain, because that would be invasive.
So the test is just a DNA swab of the mouth of the dog or the cat. It's just a swab then, a DNA swab, right, Dr.?
Yeah, and we have it available for swab testing because it's easier for pet owners, but we also have it available for blood tests because that's easier for veterinary practices.
Oh, right.
Well, I have to tell you, Dr. Mealey, when I've been retired 6 years, but when I would have pet owners in, say, and we'll talk about the breeds that are most affected. Say I would have a collie in, and I would say to them, now, have you done that DNA test for this P-glycoprotein? They had no idea what I was talking about. So a lot of veterinarians aren't aware of this. And to be honest, I watched your webinar at one point where you showed a collie that was given Imodium for diarrhea and went into a coma.
Oh my gosh.
Sadly, I'm aware of a case where an emergency room physician had a collie. They gave it Imodium. They went to the collie had this severe CNS reaction and went to a veterinarian. The veterinarian thought it was some acute, horrible infectious brain disease, encephalitis, and they euthanized the dog. So, yeah.
Oh, no.
It was really disheartening for us. So we do. I mean, I've, published this in numerous papers. It's in numerous textbooks. It's in the formularies that everybody uses for veterinary medicine. So, we continue to try to get the word out for dogs, but also for cats, right? So dogs, we discovered the mutation in 2001. So that's getting to be kind of old news. We just discovered the feline one in 2015. So we're trying to get that information out for cats too.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets.
Hi, everyone. I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
And Janet, when you do this test on your pet, then you can go on their website because new drugs are added all the time as to what your pet can be affected by.
So you'd be updated if you're a pet. That's incredible. Can't we use this on humans?
Well, it's interesting that you say that. So we, there are a couple of mutations of the same gene in humans, but they are much, much more rare. So it probably wouldn't be cost effective, and the likelihood in humans is so much less than it is for dogs and cats. Like, for example, 75% of collies have this mutation. 50% of Australian shepherds have this mutation. It's less than 0.1% in people. So that's where the difference is.
Oh, that's the difference. Okay, what about golden retrievers? Are they okay?
Interestingly, we have seen very rare positives in supposedly purebred golden retrievers, which would be unexpected. But
I have both of mine tested. Any pet I have, I send those swabs out, and we have a link on the show notes as to where to send the.
So I could get that test myself for lips. Okay,
but go on about the goldens.
Yeah, so that's surprising. We've had some surprising breeds. So the most common breeds are the herding breed dogs. So 75% of collies, 50% of Australian shepherds, 50% of English shepherds, and smaller percentages of border collies and German shepherds, old English sheepdogs. But we've had some weird breeds come up, like boxers, purebred boxers, very small percentage, Siberian huskies, and even a few golden retrievers. So, and mixed breeds of things that don't even look like a herding breed dog come back positive.
I think it's interesting that one of the new anti-tick, anti-flea medicines for cats has been giving cats problems. So another good reason to have your cat tested.
Yeah, that one's been really hard for me and my laboratory group.
But so, Dr. Mealey, as far as cats go, you probably don't get a lot of tests from cats so much as you get from dogs. People wanting to know the sensitivities, correct?
Yeah, so right now we're getting about 10% of what we get is from cats. And a lot of that has been, unfortunately, from cats that have experienced that severe adverse drug reaction to this over-the-counter product. I'm sorry, it's not over-the-counter. Let me go back on that. They've cats that have experienced this adverse drug reaction to a flea preventive. And the important thing is it's the label dose. It's not an extra label high dose that sometimes we have to use in veterinary medicine. It is the label dose. And it's the fatality rate, if the cat has the MDR1 mutation, is about 50%. 50% fatality rate for a product that's on the market if you use it exactly according to the label.
So how do you know if your pet, because they don't talk, right? They can't communicate. How do you know if they're having an allergic reaction?
So it's not an allergic reaction. It's a adverse reaction.
Okay.
So that's, yes, it's very different.
Adverse. Thank you.
An allergic reaction is very different. So for this particular adverse drug reaction in cats, owners notice very quickly. I mean, the cat is staggering around. It starts off staggering around. Their eyes get really dilated. They eventually get so weak that they collapse. They can go into a coma. And the other interesting thing about this particular toxicity in cats is they can't use their tongue. So they can't eat, they can't drink. Veterinarians need to know that they need to recognize that, because instead of giving them an appetite stimulant, which we've seen, looking at the medical records, they need IV fluids and they need some way to bypass the tongue so that they can get nutrition.
Now, if people hear, when they're reading about this, if they see or read about MDR1, explain what those three letters mean and number.
Yeah. So do you want me to go back to how it's kind of an interesting story in terms of how it was covered, or is that just way too much detail? Or we can go there and then you can.
I love the detail.
Okay.
Because the detail kind of feeds upon itself.
Okay. So the MDR1 gene, that's what it's called. It wasn't something that I named or anything like that. So the MDR1 gene was named that because when it was discovered by a group of cancer researchers, and they were looking at drug resistance in cancer. So they identified this protein, which turns out to be P-glycoprotein, and they called it the multi-drug resistance 1 gene because cancer cells that had that protein were resistant to lots of different anti-cancer drugs. So that's how come it was called the multi-drug resistance 1 gene, or MDR1 gene. So we've obviously, it was named that gene, so we've had to keep the name. We've just found the feline and the canine version of it.
I see. So we have the gene, correct? Everyone has the MDR1 gene, but whether there's a mutation there is what makes the difference.
Correct.
Is that correct?
Yeah. So everybody has the MDR1 gene, which codes for P-glycoprotein, that very protective protein pump. And so you can't just say, yes, my dog has the MDR1 gene. Well, I can say, well, so does mine.
Yeah.
But that doesn't mean anything. If your dog has the MDR1 mutation or your cat has the MDR1 mutation, that's when the drug sensitivities will affect your pet.
And isn't that interesting? Because before any of this was known, remember, Dr. Mealey, we always said, oh, better not give that collie ivermectin. They're sensitive to it. Well, this explains so much. When I go to my doctor and they say, do you have any drug sensitivity? I laugh and they don't get the joke. I say, yeah, I'm like a collie. What are you talking about?
Yeah.
And then I have to go into the whole P-glycoprotein thing. And then they're like, eyes are circling in their head.
I keep my list in my phone because when they ask you, I'm like, wait, I'm forgetting a couple of them.
Yeah.
Hold on.
We're just smart.
There's more.
Yeah, wait, there's more.
Yeah. No, but I find that so fascinating because as former pharmacists and veterinarians, it would kill us to put a pet on a medication that they have a reaction to. I mean, I would hate that. I just love that there's an explanation or a preventative, if you will, that I've got some knowledge. Hey, this is a collie and it's a MDR1 mutant. No way am I giving it ivermectin or Imodium or some of the
or one of the other dozens of drugs that can cause problems. That's what's so fascinating about this protein is it doesn't just pump one drug. In human studies, they've shown that there's 200 different drugs that get pumped by P-glycoprotein. Not all of them have serious toxicities that we have to worry about, but a lot of them do.
And Janet, look at the list of all the drugs. I'm serious that I was running off. It's just fascinating. And you're adding more to that all the time. Isn't that true?
So,
Okay,
go ahead.
go ahead. No, go ahead.
So, in human medicine, even though the mutation is very rare in humans, it is required by the FDA and the European equivalent that they put on the label whether a drug is pumped by P-glycoprotein, so that physicians and patients will know if that drug is going to be safe for them. So far, that's not required for veterinary drugs, for drugs for cats or for dogs, although that is something that I'm really trying to work with the drug companies and the FDA on. So since that information isn't on the drug label, my lab has taken it upon ourselves with funding from the Call It Health Foundation, with funding from the Every Cat Foundation, from individual donors, we developed an assay to try to determine what drugs are going to be a problem for pets with the MDR1 mutation. So it's something we work on every day until the FDA, yes.
Blue Buffalo natural veterinary diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo natural veterinary diets.
Hi, everyone. I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So how did you just wake up in the middle of the night and go, hey, I'm onto this. I get it. Like, how did it, do you see what I mean? Like, you know how sometimes those ideas just kind of gel all of a sudden? How did you figure that out?
I was studying drug resistance in cancer. It was part of my PhD project at Texas A&M University. And in my reading, because, when you're doing your PhD, you are just reading everything you can possibly get on this protein. And there was a laboratory in the Netherlands at their National Cancer Institute. And they developed a mouse that did not have the MDR1 gene. So they did some genetic engineering, took out the MDR1 gene in these mice. And way back then, if you created a knockout mouse model, you would usually find some amazing physiologic defect that these mice would have. And you would get this wonderful paper and, in a great journal. So I don't know if this is what happened. This is what I like to think about, though. Okay, I'll tell you what's true and what's my theory. So my theory is that they had these mice, they got a publication, it wasn't that exciting. Maybe they didn't pay attention to them as much, but whatever the case may be, what actually happened is that the mice developed a mite infestation. Mites. Okay. Now Alice knows where I'm going with this. So the protocol is to spray the room with ivermectin. So the next morning they came back, half the mice were dead. It turns out it was the knockout mice.
Did they figure it out right away?
Well, because the researcher, instead of just saying, well, somebody must have used the wrong dose or whatever, the researcher decided to look into it. And he found that ivermectin concentrations in the knockout mice of their brains was 80 times higher than in the regular mice. So that just illustrates how amazing that pump is. It pumps out, 80 times the concentration. So they published that article. I read that and said, okay, that must be what's going on with the collies. So that was my aha moment. based on a serendipitous discovery in the Netherlands.
So how did the mice ingest it? It was just in the air because they pumped them. Huh.
And Janet, also as a prescribing veterinarian, we had to, as veterinarians, we had to be careful to not use two of those drugs together because 1 + 1 could equal 4 in the pet. But Dr. Mealey, I remember lecturing a long time ago, and I can't remember where I was lecturing about something about derm, and a local vet came up to me and said, it was probably something about ivermectin or selamectin or one of the avermectins. And he said to me, after we spay or neuter a cat, we always take a drop of ivermectin injection and put it in the ears in case they have ear mites. And he said almost all of them came out of it with neurological issues. And I said, if I were you, I think I'd stop doing that.
What is that? What is that chemical?
So the chemical ivermectin is actually one of the things I talked about, right? It is a derivative of a soil microorganism. So it's a microorganism producing a toxin to protect itself. And a drug company isolated that and did a screen of like what kind of potential uses might this have. And one of the screens, it revealed that ivermectin killed parasites. So they developed it into for ag animals. It was one of the first products that was initially developed for veterinary medicine rather than human medicine. Usually, we in veterinary medicine borrow the human drugs and use them in animals. This was one of the first to go the opposite direction.
And you know what, Dr. Mealey, having said that, I just read yesterday on one of my daily medical things, some woman died from an overdose of ivermectin. She and her husband were taking it twice daily for cancer, quote unquote, and she became toxic and died.
Well,
so you just can't do this stuff willy-nilly.
It is the strangest thing that during COVID, a lot of people were taking ivermectin. And because I have published probably more about ivermectin toxicity than anybody in the world, we were getting calls from, physicians. We were getting calls from medical examiners' offices about this problem because there was a lot of people that got seriously, neurologically ill or died from ivermectin. And, whether they had the genetic mutation or whether they had another drug that was interacting with P-glycoprotein, we don't know. But
it's an easy drug to mess up on the math as far as doses. And I'll give you an example. I had a vet tech in. Her boss called me and said, her Rottweiler just had puppies and it's itching its brain. She brought the Rottweiler in. It had scabies. And at the time, we were using ivermectin. So it was a 60-pound dog. And I said, okay, you give 0.6 ml, okay, 0.1 ml per 10 pounds body weight. So I said, can you get that, at where you work? She said, oh, yeah. So her boss calls me that night and said, did you see the dog? I said, oh, yeah, ivermectin is getting 0.6. She said, oh, my God, Alice, she went home with a 12 cc syringe. She gave 6 cc's, not 0.6. And the dog became acutely blind. And it was rushed to our local ophthalmologist. It made it. He saved it. But it just goes to show you, even people that work in the veterinary field can screw up on the dosage. And Janet, you can buy ivermectin at the feed store for animals. This is how humans get it to use on themselves. Even though we're concerned here with pets, but I'm just saying. Yeah. That's why when owners would call me and say, well, instead of, say, HeartGuard, I want to give my pet ivermectin as our friend, I would never let them do that because if they screw up that dose, like that vet tech did, they can either have a dead dog on their hands, a blind dog, or a neurological.
Yes.
Well, and the other thing is, it's like pet owners, or even like when my kids were little and they give you a prescription and they say blank mLs. Well, I'm used to like teaspoons. Do you know what I'm saying?
Get it. Yes.
Like, like baking teaspoons. Yeah. And it's a foreign measurement. So if I were giving 2 minutes, like even when I had the cat that I was giving the
She was
Insulin.
diabetic.
Yeah.
I swear to God, you guys, I would look at that syringe like 5 times because I didn't want to screw up. Like I'd look at the thing and we had it posted all over, like this is how much you give her. Because we were afraid we were going to overdose her, and then what?
Yeah. And we as veterinarians can do better. We can take pictures and show people this is the amount that you need to use. So we as veterinarians, we can do better as well.
Well, I have to say, true.
And the rule in my office was if we were ever dispensing in the old days, ivermectin, nothing larger than a 1 cc TB syringe went out of that office. Nothing larger, because I was trying to ward off a screw up in dosage before it happened.
Well, and I have to tell you, when I found out the cat was diabetic, and then the vet assistant was like, and I'm going to show you how to inject the cat. And I'm like, no, I'm not doing that. And sure enough, we were all doing it. The whole family was doing it. But as a non-doctor, it's terrifying.
Well,
it is, but it isn't. And I was telling Janet, Dr. Mealey, of when I would put a cat on desensitization shots once a week, and I would show the owner, and we'd be talking. They're like, well, when are you going to give the shot? I'm like, well, I already gave it. You just missed it. 15 minutes ago, we just did it. Yeah. The cat's just, sitting there real nice.
But if you're not used to doing that kind of stuff, it's like unsettling.
My favorite story is the owner of a chocolate lab that we had on immunotherapy to desensitize for allergy. And she was so afraid of needles, she went on to become a nurse. And I'm personally proud of that.
Wait, you also had the police officer that about passed out.
Yeah, he did about pass out. And so then he brought the cat in each week and we gave the allergy shot.
And he carried a gun and killed people?
I know. My technician was a former, she's a farm girl. And she said, what do you mean you can't give this cat a shot and you carry a gun? So it was, yeah. Anyway, so what pets do you have, Dr. Mealey?
So right now we have a new German Shorthair puppy.
We can't wait to see the picture.
Yeah, that's keeping us up at night. And we have a 6-year-old fox terrier.
What are their names?
Morty is the fox terrier, and Cisco is the German Shorthair pony.
Now, do you do MDR1 gene testing on them?
Of course, they're my pets. They got to have it,
Of course.
Yeah.
Oh, and we should mention it's we'll have the link for where you can do this test. It's $70, I believe, right?
Okay.
You just pay with a credit card. Then they email you the results, and then you sign up so that you update as far as the list of drugs that this dog or cat could be sensitive to.
Yes, and the other thing that we've done now is because there's a lot of dose reductions, so it's not like if the drug is on the list, you can't ever use it, right? So it's okay. There's dose reduction. So as we know, you get 1 copy of your gene of a specific gene from your mother, 1 from your father. So you have the potential to have 2 copies of the mutation, or you could just have 1 copy of the mutation. So drug doses depend on whether you have 1 or 2 copies. And so we have introduced 2 apps, one for dogs called MDR1 Caddy, and the other one for cats called Whisper, as in PURR Whisper. And what we do is we allow people to select drugs from a list, which are the drugs that are going to be added to the patient, which drugs are they already on, and it will provide dose reduction information for the pet owner or for the veterinarian.
I love that because it educates the veterinarians too.
Yeah, some of these drugs are really important, right? They're inexpensive and they're good for spays and neuters and other surgical procedures. Some for cancer, and so it's better to if you said don't use it at all, we're missing out on good therapeutic opportunities. So using the correct dose is safe.
I think any pet that's going to have chemotherapy for sure should be tested, because a lot of those drugs on that list are chemo. And then, of course, you get the people that I'm not putting my dog through that. Well, I'm going to tell you something. One of my rescues had lymphoma, and she did very well. She lived 2 years, had no side effects at all. I would do it over again in a minute. And this is before the MDR. Yeah, is that right? What breed was your?
And we decided to use.
Mine was Felix.
And
hounds.
1 year, complete remission, no side effects.
Right. And mine couldn't do the pred part of it. couldn't do the steroid part. After 2 days on the steroid, I called my friend who's an internal medicine vet. I said, she's not the same dog. So we took her off of the pred and she just had all the others. And she did
I
great.
would say
so,
try methylpred.
Yeah. Right, exactly. I'm going to tell you, 2 pharmacists turned vets. It's like the helmets on Monday Night Football exploded.
You guys are dropping words that are just like.
Well, feel free to ask questions because that's why we're here. Yeah.
Well, this has been so informative. I have to ask the question, Dr. Mealey, what is your pet or human peeve?
Oh my God. About like with regard
anything driving, anything.
Well, I have to say ivermectin use for unapproved purposes right now is kind of big for me.
You know what? I'm like the antichrist of ivermectin, like I'm the antichrist of steroid. You know what I'm saying? People are like, well, just give him ivermectin. I'm like, no. And the other thing I've noticed about ivermectin, and I just want to put a bee in your bonnet, elderly dogs seem to have an issue with it too. And I don't know their MDR1 mutation status. And I'll give you an example. Back in the day, again, before we had the isoxazolines, before we had, the Bravectos and all those Simparicas, we would use ivermectin daily for Demodex. And I remember having an elderly golden become ataxic, walking like they're drunk, Janet, like on the 3rd dose. And the protocol, of which I never followed, was you give a certain dose the first week, you go up the second week, go third. Whenever I lectured on this, I'm like, do not follow that. Because it takes a while to reach steady state. You reach steady state, and then you're increasing the dose.
Well, and I wonder, I would love to go back and look at the other medications that dog was on, because we had a lot of times when people would call us and say, your test is wrong because it said normal and our dog had this reaction. And I'd say, okay, what other medications is your dog on? And it would be ketoconazole or cyclosporin. And you're like, yeah, this is what's happening with your dog. So
exactly. They don't understand that one can enhance or draw back the other, either way.
The other thing I want to bring up about ivermectin, just to make sure that people understand, is the doses that you're talking about are in the range of like 200 to 600 micrograms per kilogram for mange. Okay. The dose in HeartGuard is 6 micrograms per kilogram once a month. That is safe for dogs, even the ones that have the MDR1 mutation. So it's a huge difference. So ivermectin can be used at heartworm prevention doses very safely in any dog.
And am I correct in when I see on the drug insert for some of the isoxazoline drugs like Bravecto, Simparica, NexGard, they have tested MDR1 mutant positive dogs?
Yes. And so the seizure activity that has been associated with those is not related to MDR1. It's real, but it's not related to MDR1.
I have not read that, but I was listening to a webinar that mentioned that. Yeah, absolutely.
So I just Googled ivermectin, and it's a whole article about ivermectin and COVID-19.
Oh, yeah, absolutely.
See, now I remember this from COVID.
There's some couple of channels, I think, or podcasts websites that are promoting ivermectin for treating cancer for dogs and cats.
Yeah.
And it really bothers me because it's not been shown to be effective when we have such an amazing effective treatments for some types of cancer, for lymphoma and things like that. So I think it's doing a disservice to the animal, unfortunately.
That's probably on TikTok.
And having said that, here are 2 pharmacists turned veterinarians who both dogs have had cancer.
Right.
And don't you think we would have reached for that, knowing what we know? I mean, but we didn't. Because we know it's not safe. And I'm not sure why the information gets debunked.
I don't know.
Like we're not keeping some sort of secret. You know what I'm saying?
I'm not getting paid by the drug companies.
No. If anything, I'm anti-drug company. You know what I'm saying? Yeah. People that know me. So they've really got to prove to me that their drug works and that they didn't doctor the research and all that kind of stuff. But anyway, yeah, believe me, if Dr. Mealey's dog and my dog that had cancer, if we thought ivermectin worked, I'd be the first buying
it. Using it.
Yes.
Well, this has been incredible.
We did hear her pet peeve was the ivermectin. Yes, I apologize.
The ivermectin, that's our vocab word for the day.
Janet, you learned something today. Well, you always do.
By the way, the big rush was because our golden retriever knows the UPS guy, the Amazon guy, it's unbelievable. And sometimes if we're not home, the package will be outside like this with a little biscuit on top.
Ours did not give any treats. Our UPS treat man retired.
And even one of the drivers, I think it's FedEx, he'll go, I don't have anything for you today. I'm just petting the dog. It's a dog.
So anyway, Janet, let's wrap it up.
Okay.
Anyway, please, the link to get this test is in the show notes. Please do it. Every pet I have gets swabbed for the MDR1 mutation. Janet, you have to do it for Libby. And so
I'm not doing it for the cat, for Atticus.
Anyway, this is Dr. Alice Novotny-Jerome, and thanks for joining us. And
Janet Novotny-King. I'm just a pet owner. I'm not the Dr. Schmachter, but thank you for joining us. And this was so informative. Thank you so much, Dr. Mealey. We really appreciate your work.
Thank you for having me.
Hey, thanks for watching
and listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
The Speaking of Pets podcast is an SLA video production.